I begin today by acknowledging the traditional owners of the land on which we meet and pay my respects to their elders past, present and emerging, and I extend those respects to any Aboriginal and Torres Strait Islander people here with us today. Thanks, Simeon. You can start the ward round. Diversity at Eastern Health is really important because it reflects who we are. We know it leads to better patient outcomes and happier staff.
Diversity is important at Eastern Health because as a junior doctor it allows us to have an environment that's enriched so we can learn, grow and create.
It's really important for our patients to see healthcare staff from lots of different backgrounds because patients need to be able to see themselves in us, and then equally we need to be able to see ourselves in each other.
Eastern Health is a young health network. We started with a bunch of community hospitals that were amalgamated together 21 years ago. We now have 10,000 staff, and the community that we serve has a very large population which includes Indigenous patients and people, post-colonial Australians, and a very large Mandarin-speaking population. And to serve those people well, we need to have diverse staff. We know that in Australia, our top-tier companies perform better if they have greater gender diversity, and we know that our patient outcomes are better if we have gender diversity and more diversity from a cultural perspective within our staff. Eastern Health Urology has 16 urologists, 25% of whom are female. We provide services in female pelvic medicine and reconstructive surgery, stones, uro-oncology, and we have a great service that has clinical work, research and education. My passion is female pelvic medicine and reconstructive surgery, and we've set up a really comprehensive local anaesthetic Botox service. We have a diagnostic service, and we provide mesh and non-mesh alternatives for the treatment of prolapse and incontinence.
We undertake research in a number of different arenas within the urology department at Eastern Health. The biggest efforts are in being involved with international studies, and we contribute patients. Those are collaborative efforts organised with multiple other units around the world. We also have local research students who are learning the process of doing research. They are often junior medical doctors who are interested in pursuing a career in urology.
My research project is looking at mutations in DNA and monitoring them while patients get treated at Eastern Health. The urology department here in the Eastern Health Clinical School have provided a great support system for me to carry out this complex research. The patients that I have here are so broad and multicultural that I really do feel my findings will be applicable worldwide. The Eastern Health Clinical School has amazing supervisors and a fantastic lab for me to work in where I can really achieve my goals.
We also have a very culturally diverse urological population. Of our 16 urologists, 75% of them have a parent who was born overseas or they were born overseas themselves. And in fact, 4 of them speak a language other than English regularly. We've been very successful at Eastern Health in supporting the growth of women in their urological careers. We started in 2019 with one of the first recognised flexible training programs. And those sort of initiatives like flexible training is how we're going to keep women in surgery.
I feel supported in my work at Eastern Health through so many ways, and really at the centre of it is having visible female leadership with our Head of Unit, Associate Professor Caroline Dowling. She's empowered us to make the decisions that are right for our careers and for our patients, and really has fostered such an inclusive environment. The transition back from parental leave was very smooth, and I felt empowered to return to work after that.
I'm a big fan of the concept of you can't be what you can't see. Providing visible female leadership and role models in the unit has allowed staff to be more open about their needs. I had a male trainee who took more extended paternity leave after he saw the female models around him doing similarly. We also have a gender action plan which the hospital has put together, and people are acutely aware of what that provides in terms of opportunities to discuss ways of coming back to work.
At Eastern Health, we have in-house interpreter service, which helps us with translation and meeting communication needs of our diverse population so that we can provide them with service that they need as well as meet the standard they expect.
I think as a nurse, it's really important to acknowledge people's diversity, especially when you're dealing with patients who can't speak English, making sure that you get the right interpreter for that situation, making sure that you wait till you get that female interpreter so that you can do that personal education so that person doesn't feel intimidated and feels open about what we need to learn together. And you sometimes just got to get to know the patient to decide what needs to be met.
for someone with a disability like myself, having to speak to somebody with staff that actually really understand the disease and be able to understand me has been a weight off my shoulders.
Diversity is a really important concept now. It's not just some passing trend. It's something that we're all going to need to embrace, and we'll all be better for doing that. There's lots of research to say that diverse teams and diversity itself is going to help our patient outcomes and our staff satisfaction.